Now let's have a continuation of previous class that we were discussing about infusion pump, right? So in this class we will going to have a deep insight about what are the different classification of pumps are there based on the technology. So as I said before, in infusion pump there is majorly classified into two types. One is gravity control pumps, another one is positive displacement pumps. So what is all about gravity control and what is the positive displacement pump in the sense? The gravity control pumps where you are having the flow of liquid or flow of drug, whatever may be, it is happening based on the gravity. Okay, so because of this gravity principle, the drug is being delivered automatically to the patient. So that is called gravity. So that in this case, if you see the drips which is being placed above our chest level, so that because of this pressure difference and the gravity force, the fluid which is hanging out in the stand will automatically flow down against the gravity and easily get into the patient. So that is the gravity control pumps. So under which you have a two types. One is drip rate regulators, another one is drip rate controllers. Yes, so see on right left hand side you can see the stand which carries the drip rate regulators, and also in other hand you will be having the saline which is the fluid to be injected to the patient. Okay, so these two type of pumps, that is drip rate regulators or drip rate controllers, it is being work based on the gravity. So because of this the fluids easily get infused into the patient because of the height difference between IV bag and the patient. So in such a way we have to place the whole overall setup that is above the heart or above the chest level of the people. So then only because of the gravity, the height difference, the fluid from IV bag is slowly get into the patient. So then what is the difference between drip rate regulators and drip rate controllers? In the sense, in drip rate regulators we don't have much electronic components to control the, to monitor what is the drip or a drop per unit is happening. Okay, so the control and also we have option called a clipper over the tube. Through that clipper we can easily, roller clamp will be there, so which help of this roller clamp we can easily control the size of the tubing. Okay, so we can reduce this. If we are reducing the size when we are by pressing the roller, then according to that the liquid flow will also reduce. If you are releasing the roller clamp back to the original position, in the sense, then tube will get free. Now it have a full fledged fluid flow. So according, based on this, with the help of roller clamp we can easily adjust the fluid rate. That is the case we can do it in dip rate regulators. Other than that we don't know what is the actual drops per minute is happening. Okay, so this type of drip rate regulators we can use in non-critical IV fluid administration. What is the limitation? In the sense, we don't know what precisely it's happening. Okay, so because just we are pressing the tube with help of roller clamp, because of that the fluid is getting adjust or reducing. But actually what is exact value we can't easily measure in case of drip rate regulators. Whereas in case of drip rate controllers, that is the second one, additionally it has one component which will tell you what is the drip rate. You can, by seeing that we can easily identify, we can easily ensure that what are the values and what are the values we have been fixed, or we are, to the level we have adjust, it is been maintained. So we can ensure in such a way, that is by using drip rate controllers. That is the main difference between drip rate regulators and controllers. In regulators, there we don't have any options to check or ensure whether what are the values we have been fixed, which has been delivered to the patient. In case of drip rate controllers, we have the extra component, that is a sensor or something, where we have mechanical or simple electronic components also there, in order to maintain the consistent drip rate, and also we can ensure the drip rate also. So this is slightly good it gives slightly good accurate level or accurate values compared to the drip rate regulators. So these two are the gravity control pumps. So second one is what in the sense that is passive displacement pumps. So this type of pumps where the movement is happening because of the motor. Okay, so whereas in previous case we will be discussing based on the gravity the pump and that infusion is happening in the patient, but here we are making positive displacement through which the fluids are getting into the patient body. So what are the different positive displacement pumps are there in the sense we have drip rate pumps, volumetric pumps, syringe pumps, ambulatory pumps, and so on. Because here we are not looking for any gravity, we are doing independent of gravity, that is we are pushing the fluid by making the positive displacement with the help of different types of motors. Okay, so if you see the first one, drip rate pumps, here also we have we have the option to control the number of drops or drip which is being delivered to the patient per minute with help of sensors and actuators, because the sensor will sense whether there is any block or something, that is air block or any any pressure deviation or a flow deviation which is easily indicated, which is easily being communicated to the physicians or nurse, then they do it manually correction, or it can they can go with automatic corrections also. That is the drip rate pumps. Whereas if you see the volumetric pumps, it is also called the same infusion pump, because here we will be sending the large amount of fluid over certain period of time. Okay, that's why this particular pump is called infusion pump. Whereas the large quantities will be infused, especially when high infusion rate is required. Okay, the working principle also it's very simple, because here the fluid of volume of the fluid which simply draws from the IV bag and then injected to the patient with the help of this volumetric pumps, where the motors will give the driving action, so that the fluid is slowly getting into the moving and getting into the patient body. So what is the advantage in the sense, here we can see the high accuracy and volume control which works under pressure different variations. So next one is syringe pump. In case of syringe pumps, which is almost similar to the infusion pump, the difference is that we can infuse here very low flow rate. Okay, we will fix a very low level of fluid to be flow inside the body. For example, if you say 0.1 ml to 1000 ml, like that we can fix. So if you are fixing in microliter, in nanoliter fluid is to be injected in the sense, then we have to go with syringe pump. Or if you want to inject in range of ml means, then you can go with normal infusion pump. That is the main difference, because in syringe pump we are injecting the fluid in microliter level, that is very low level. What is the mechanism which is behind in this for delivering the fluid in the sense, piston mechanism, whereas in infusion pump the peristaltic mechanism will be followed. If you see in left hand side, I have been mentioned two figures. One first figure will be the example for peristaltic mechanism, that is will be carried out by normal infusion pump. The second one is called piston mechanism, which is being involved in a syringe pump. So these are two mechanisms you can see in any sort of infusion pump, that is a drug delivery system. One, either it go with peristaltic pump, that normal infusion pump will do, and second one is like a syringe pump, that is based on a piston mechanism. So we have syringe we will place the syringe in the device in horizontal way. The plunger of the syringe will move according to the piston direction. So the piston will be controlled by the motor. So this is how the syringe pump will works. So that is the motor will drive based on the need, or based on the speed what we need as a flow rate. So this piston will be attached to the plunger of the syringe. Okay, as long as the piston moving, the plunger of the syringe will also move accordingly. So what are the fluid which is there in the syringe, because of the plunger movement and the piston movement, the fluid also slowly getting into the patient through the tubing. Okay, so tubing is attached with one end of syringe, so through which the fluid slowly goes into the patient body. That is the syringe pump. Whereas in infusion pump we have the peristaltic setup, that is a roll of fingers will be there inside the infusion pump. So that roll of fingers will continuously press and compress and release the tubing based on the flow rate or pressure whatever we have fixed in the infusion pump. So according to that compressing and relaxing the fluid, one point to another point is slowly moves, and then finally it will deliver to the patient. So this is the major difference between piston mechanism and the peristaltic mechanism. And last one is you can see the multi-channel pumps, and you have one more thing, that is ambulatory pumps. It's very simple, because in multi-channel pumps, if you see, we have a n number of infusion pump which is being arranged in such a way like one component, that is one device. So in this infusion pump, if there is a patient if there is a patient where more than 2 or 3 fluids has to be injected parallelly or simultaneously, in the sense, then we can go with this multi-channel pumps, because it has the feature or provision to send the fluids in different flow rate parallelly. So that is the meaning of multi-channel pumps. Other than that, the working mechanism of this multi-channel pumps is similar to the normal syringe pump or normal infusion pump. The thing is that we can send multiple drugs at a same time by using a single interface, that is in single infusion pump. Ambulatory pumps, in the name itself, we can easily guess it that we can wear it over our body, and then we can carry out our routine daily activity without any disturbance, because this infusion pump is a battery operated one and portable, and easily we can put inside our pocket or in our dress, and then we can go with our daily routine works. Because there are certain condition, the patients has to be medicated continuously 24/7, or if there is any long medication management is there for the patient, then we can go with this ambulatory pumps, because it is very simple, easily carried by the patient, and also it will not disturb the patient's other daily activities. So for example, where you can use this type of ambulatory pumps, in the sense chemotherapy, pain management, and home infusion therapy. So the main advantage of using these ambulatory pumps, in the sense, it can allows the mobility, that you can move from one area to another freely, and then also parallelly you can have the continuous drug delivery. Even you can do it in outside of the hostel at your hospital, or even in at your home. So that is the main advantage of ambulatory pumps. Yes, with this we will complete. We have completed what are the different types of infusion pump. That is, one is based on gravity, another one is based on positive displacement. In next class, we will see what is the block diagram of this infusion pump. Thank you.